Your heart needs to be strong to keep up. Flora, for a strong heart today. Managing cholesterol can be as easy as changing your lifestyle, but in certain circumstances you may need statin medication. We spoke to Dr. Joe Bodenstein to find out how statins work and in what instances a patient would require them.
When referring to statins, we are referring to drugs that are used specifically for the lowering of cholesterol in human beings. They're very potent drugs. They are much more potent than dietary measurements for reducing cholesterol. And they're also the second most prescribed drugs in the world after antacids. Statins work by inhibiting an enzyme, the HMG coenzyme A reductase enzyme. This enzyme is used in the production of cholesterol in the liver. So by inhibiting this enzyme, cholesterol levels in the body drop.
Factors which influence the decision to prescribe statins are hypertension, family history, as well as the patient's Framingham risk score for cardiovascular disease.
Statins are a lifelong commitment, and the very simple reason is that we do not cure hypercholesterolemia, we merely control it. So in the first place, you have to decide, are lifestyle modifications going to be adequate or not? If lifestyle modification is not adequate in controlling the cholesterol and we do decide that medication is necessary, we need to appreciate that this medication is going to be necessary lifelong. Lifestyle changes are very important, and I think it is naive to suggest that it's okay just to pop a pill. People should appreciate that lifestyle modification is actually the cornerstone of this therapy. Cholesterol can sometimes be managed without medication. Lifestyle modification in that sense is very important, and the first step would be to change your diet.
Registered dietitian Kelly Schroeder believes lifestyle modifications can change your cholesterol, but one needs to be savvy about the changes you make.
Lifestyle changes can reduce your cholesterol by up to 30%, so everything you do will have a lowering effect, or it will increase your good cholesterol in your body slightly on some level. So what you want to do is take all the possible lifestyle measures that you can. And some of those include smoking. If you smoke and you quit, it's a really positive thing for your cholesterol. If you drink alcohol, then try to keep your alcohol intake really moderate. So you need to have 1 or 2 units of alcohol a day maximum. So 1 for women, 2 for men. And that's very little. So it's actually about 125 milliliters of wine. It's a lot less than we usually drink. Another thing that you can do is lose a little bit of weight. If you lose 5 to 10% of your weight when you're overweight, that can have a dramatic effect on your cholesterol levels. And the best way to do that is to approach it slowly with a lifestyle plan. A crash diet isn't going to be sustainable long term. So what you want to do is a regular exercise program and a balanced diet with an awareness of portion sizes overall.
Regular activity like a brisk 30-minute walk each day can help you lower your LDL or bad cholesterol and raise your HDL or good cholesterol.
Foods play a very important role in managing cholesterol. You can look at 2 major things in your diet. The first is fiber and the second is fat. So if you think about fiber, you get very good fiber from whole grains and fruits and vegetables. If you look at fats, there are good fats and bad fats. So on the bad fat side of things, you have trans fats and you have saturated fatty acids. The saturated fatty acids you get from dairy products and meat mainly, and the trans fats are found in commercial baked goods and fried foods. You need to reduce your overall amount of fat that you're eating in your diet, and then you get the greatest benefits if you replace saturated fats with good fats, with polyunsaturated fats from vegetables and from fish. Another thing that you can add to your diet are plant sterols. It can be taken in a supplement form and sometimes in margarines. But the important thing to remember is that you need a specific dose in order for it to be effective against cholesterol.
Before embarking on any effort to lower your cholesterol, get tested and consult with your doctor to decide on a safe and effective program for your heart health. Your heart needs to be strong to keep up. Flora, for a strong heart today.